Hi, everyone, and welcome to your first podcast for lab. What I mean by a podcast is that each week before lab, you will get a recording of me talking about the chapters that we're going to be doing in lab. The reason that I'm doing this is lab only gives us a certain amount of time, and we don't have enough time to do lecture and to practice all the skills that we need to learn for this class. So a lot of the information from a lecture standpoint will come in these podcasts that will be done before class. So the lab portion for this class is really looking at learning those skills and honing in those skills that you need in order before we can go to the clinical setting. It's going to be really important that you read the chapters that we're going to be discussing or working on in lab before coming to lab. When you listen to this podcast also before coming to lab, what you'll want to do is I will have the podcast and the PowerPoints posted in Moodle. What you'll want to do is while listening to the podcast, you'll want to take notes just like you would in class. When you have those notes done, you'll have those done before you come to lab. You want to bring those notes to lab. And then at lab time, at the start of lab, I will look on those to make sure that you got those done. If you come to lab without those notes done, without the recordings listening to, you'll be asked to leave class or to leave lab that day to go finish up your notes, and then you'll be doing all the lab stuff out of class on your own time. What I would suggest is just come with it done. It's not that big of a deal, and I don't like to waste my time, and I don't like to waste your time. So just be done and have your stuff ready to go when class starts. Before we kind of get into the material, I just want to look, making sure that you take your textbook to lab each day, along with the notes that you have taken on these podcasts. Your textbook is going to be very important this semester, so make sure that you have that with you for class and lab. When you look in your book, some of the important aspects of your book as you are first kind of looking at this book, if you turn to a chapter, for instance, we're going to be talking about chapter 29 today, Infection, Prevention, and Control. Some of the important objects of that chapter, the objectives, are listed at the start of the chapter on page 442, along with a lot of the key terms. And now some of these you may hopefully have learned in anatomy, phys, and other classes that you have already taken, but they are going to be important to know as you work through this chapter. You'll also see at the end of the chapter, for instance, this one on page 471, at the end of the chapter, you'll see some yellow pages. Those are some of the skills and the procedures that we will be working on in lab, actually hands-on. So it's really important. We have a lot to learn back there that you come to class and come to lab ready to go. The information that we learn about on these podcasts, that we talk about, experience in lab, and also in the classroom setting can all apply to the unit exam. So another reason why it's really important to have your notes and to make sure that you are up to date. Nursing goes by very quickly. It can feel maybe a little overwhelming at times, but it's really important to stay on top of things. Otherwise, the more that you get behind, it just gets harder and harder to get caught up. I'm going to start with the infection, prevention, and control chapter on page 442 today, and that's what I'll kind of work on first here. Chapter 29 looks at infection, prevention, and control, and why is it one of the first things that we study in nursing? Well, our hospitalized patients coming into us, patients leaving us in all types of healthcare settings have an increased chance or an increased incidence of developing infection. There's a lot of different reasons for this. If you think about the patients that we take care of, we take care of multiple patients at one time. So we'll look at some of the things like hand hygiene. and ways that we as nurses can prevent the transmission of infection. We also looked at things, or we can look at things like drug-resistant microorganisms. So maybe you talked about this in maybe some of your classes, or maybe you'll talk about it in micro this semester, where many of you have probably taken an antibiotic before, and the more and more we take those, the more resistant our body gets to them, and eventually they don't work anymore. So infection prevention, those are just to name a few. There's a lot of important functions that we as nurses need to know and utilize when caring for our patients. So if you flip to the second slide, the scientific knowledge base and the nature of infection, this slide really contains a lot of key terms that you may or may not be familiar with. So patients in all healthcare settings, again, no matter where you might work in the future, are at risk for acquiring infection, because we talked about some of those things. Some other ones are the lower resistance. Some people on meds like chemotherapy for cancer patients, they do not have an immune system left in their body. It puts them at an increased risk for an infection. Increased exposure to pathogens. If you're in the hospital setting, there's a lot of sick people around. You're at increased exposure to a lot of those things that are floating, those germs that are floating around the hospital. And we also talked about some of the resistance to antibiotics. And another thing that I didn't mention earlier is even invasive procedures. Even something like sticking a needle and giving a shot ultimately does increase the risk of infection, because we're breaking that barrier of that skin, which exposes our body to things not natural or normal. So in this chapter, we're going to start by looking at a couple of those terms there. It already has infection there. Infection is the invasion and susceptible host by pathogen or microorganisms resulting in disease. So maybe we have to back up a little bit and think, well, what is a pathogen? Well, a pathogen is, we maybe have called it a microorganism, would be another name for it. You may think of bacteria, viruses, fungi, protozoa. Oh, there's a lot of different types, just a few listed there. Sometimes we might think, if you go down to the next one, colonization versus infection. Some people may think that that's the same thing, but it is slightly different. Colonization is really just the multiplication of organisms. So essentially, these organisms are growing, but there's really no potential damage. There's no really causing any type of cellular damage. They're just multiplying. They're not really doing or causing any harm right now. When we move then to an infection is the invasion and multiplication of microorganisms within the body tissue that result in cellular injury or disease. So really, infections really looking at actually invading and causing damage, where remember colonization, we're just multiplying. Communicable diseases are really just agents or different infections that are able to be transmitted. So whether we directly transmit them, we'll maybe talk about that a little bit later. Like if I have a handshake and I have bacteria on my hand and I shake your hand, that's a direct contact. I directly transmit that. Or maybe indirectly, maybe I'm coughing and it goes through the air. Those particles then will be breathed in or absorbed by someone else. So a lot of different infections. Some have a low risk for transmission. Some don't really transmit very well. And then other ones are very high, again, with the communicable diseases. The last kind of two words there on those slides is symptomatic versus asymptomatic. So we might use this a lot when taking care of our patients, just more descriptive words to when we use to kind of tell about how they're doing. Symptomatic, if somebody is symptomatic of something, they're going to show what's going on. So they're going to present with some symptoms. So you might go to the doctor with a cold. You're going to present with a stuffy nose, a cough, those types of things. We can visibly see or hear those types of things that are wrong that we can correlate. If somebody is asymptomatic, they aren't showing anything yet. So maybe I have a cold, that maybe working, those microorganisms are already working and in my body, but I haven't actually displayed the symptoms of that disease process yet. So throughout this, you can see on the bottom of the slide that hand hygiene is really one of our most important things as nurses to be able to prevent and control that transmission of those disease processes. If you look towards the next slide, chain of infection, chain of infection is a way to think about how we transmit the disease process, or how those infectious agents go from one thing to the next. So if you kind of think it's like a cycle, and what we're going to try to do is, as nurses or as healthcare providers, we are going to try to break that cycle so that the disease does not transmit to the next source. So when we look at that chain infection a little bit more in detail, the first or the top category is the infectious agent. So really that's that microorganism that I mentioned before. If you turn to page 444 in your book, table 29-1 really just lists a lot of common infectious agents and pathogens that we see a lot. Bacteria, viruses, fungi, and protozoa. So you can see some of those listed there, and it talks about the next thing, the reservoir is also listed on there, and the reservoir is just a place where those microorganisms live, so where they survive, where they multiply, and where they're trying to kind of go from one reservoir to the next place. So again, that's also listed on that table on page 444. After that microorganism finds a place to grow and to multiply, what they're really trying to do next, which is the third thing on our circle here, is find a portal of exit. So a portal of exit is really just where, if they can get out of something, if you think about exiting something, to hopefully get out somewhere else, to find another host and to cause that disease process there. So when we think of common portals of exit, how do those disease processes get out of one specific body? So we think about our skin, mucous membranes, so inside our mouth, nose, those types of things. Our respiratory tract when we cough, our reproductive tract, and blood transmission, just to name a few. So once they get out of something, they need to be transmitted some way. So when we look at the next one, the mode of transmission. So really, how are they getting to to find somebody else? So one of the modes that we try to really look at, and this is just one of the major ones, is thinking about unwashed hands. We talked about hand hygiene on the first slide. When we touch something and we don't use gloves, or we even don't use hand hygiene before and after that glove placement, when we're mishandling equipment and not cleaning it well enough, all of those types of things end up on our unwashed hands, and as a healthcare worker, then we take care of multiple patients or just even move throughout the hospital setting. When that microorganism is able to transfer to something else, it then moves into the portal of entry. So if we think of entering something, we're going into something. And so we're entering the body, usually a lot of times through that same route. And then again, we make room, or that organism decides to settle in the host, or who's ever, where it's able to be transmitted to. If you go to the next slide, which is really kind of the important thing, is how do we break that chain of infection? So when we look at the chain, what we want to do as nurses, there's multiple times within that chain in order to, if we can break that or stop the transmission of infection, we will stop and eliminate that infection or those microorganisms to go to the next person or place or whatever. So how do we do that? It's one of our main responsibilities. So a lot of times we really need to use a lot of infection control practices and really identify who's at risk, how are they at risk, and how are we at risk, and what can we do about it. So if you look again at that chain of infection, there actually was a little bit of a more in detailed one that I did upload on Moodle, so you'll want to check that out too. It will kind of help you with this next part, so make sure that you have access to that if that would help you. When we look at that chain of infection, so how can we as nurses break that chain? So when we look between the first two ones, we have the infectious agent and the reservoir. So if we think about that little line between those two boxes there, what can we do to prevent that? So things like cleaning, disinfecting, sterilizing. So we think of the tools, tables, beds, linens, different things that we use to take care of our patients. We're going to prevent any formation or from becoming a reservoir. Making sure that we cleanse that environment so that infectious agents aren't allowed to live and multiply. If it's able to get and build a reservoir, if we look from the reservoir to the portal of exit, so some of these things, again, really goes back to promoting proper hygiene. So maintaining clean dressings, linens, clean equipment. One of the things in nursing, a lot of facilities they don't allow artificial nails. Studies have shown that they harbor bacteria, and so they try to eliminate some types of those reservoirs. So if you think about your nails, especially underneath there, that's a reservoir where bacteria can multiply. Then we look from the portal of exit to the mode of transmission. These things are done to prevent the exit of an infectious agent. So if somebody's maybe coughing, we're going to tell them to cover their mouth, to cover their nose. Again, maintain that clean dressing so that we don't have that transmission point. Then next, between the mode of transmission and the portal of entry, so now it's out there. So what can we prevent it, or how can we stop it from going to the next patient? Well, one thing we're going to be talking about is called personal protective equipment, or PPE. You'll see this in the hospital a lot. It consists of things like a gown, a mask, things that will prevent us from getting that microorganism on us. There's different types of techniques that we'll talk about. Medical and surgical asepsis, we'll talk about that later in this chapter. How to dispose of contaminated objects, hand washing, all of these things, a lot of the things that we'll learn in those skills that we'll learn in this chapter really kind of also go with the mode of transmission and stopping it before it gets to the portal of entry. And then lastly, looking at the portal of entry to the next host, really looking at proper disposal of things, making sure that we're disposing our sharps in the correct way, in the correct container, needles, keeping sterile technique, keeping things like the Foley bag below the bladder so we don't reintroduce the kidneys and the bladder to an increased amount of infection and bacteria. If you flip to the next slide, it talks a little bit about the additional terminology. Again, make sure that you look at the beginning of the chapter to make sure that you've covered all of the terminology. But some of the other ones, immunocompromised, I talked about that a little bit, having an impaired immune system. Virulence, the ability to produce the disease. Bacteriostasis, the prevention of growth and the reproduction of bacteria. And bactericidal, destructive to bacteria. We'll kind of mention some of those terms later. If you flip to the next slide, it talks about healthcare-associated infections. So you'll see this a lot in what we call evidence-based practice. And a lot of the current research that's being done in nursing right now. One of the big things is healthcare-associated infections. A lot of times they'll shorten them up as HAIs. And it's exactly what it says it is. It's an infection that comes as the result of being in a healthcare facility and having those health services being done to you. A lot of times they used to be called, maybe you might be familiar with this name or have heard this name, nosocomial infections it's the same thing. So a lot of times these healthcare-associated infections, they're a result of some type of treatment. Invasive procedures, antibiotic administration, multi-drug resistant organisms, breaks in infection prevention and control things that you might help with as a nurse. Patients that we take care of who develop hospital-acquired infections are usually more susceptible to infections. So they're the patients that are probably at a higher risk to begin with, such as people like the elderly, people who are immunocompromised, so they don't have that immune system to help fight off these disease processes. People with chronic disease, meaning that chronic diseases, they might have more than one disease and they might have had them for a longer period of time. If you actually turn to page 448 in your book, box 29-3 actually lists a lot of sites and causes for healthcare-associated infections. So things as nurses that we do to try to prevent this is a lot of it, again, that goes back to hand hygiene practices. We have different types of hygiene products that we'll talk about in this chapter. That are going to be really important to, again, stop that chain of infection. Healthcare-associated infections, one of the big research things right now, and really the pushes in hospital care right now to prevent this because it increases the cost of healthcare. So very dramatically, I don't have any statistics right in front of me, but it very much increases the cost because not only is the hospital and the patient paying for what they went there for, but now they're adding all this extra, more complicated care on top of what was already going on. If you flip to the next slide, it continues on with healthcare-associated infections. I do have a list of some of those risk factors there. And you can I think we've talked about a lot of those already, and you could kind of read through those on your own. Going to the next slide, it talks a little bit about the heading is nursing knowledge base. So really, what factors influence infection prevention and control? So when we look at patients maybe that are more at risk or less at risk, how do we decide whether obviously, I think infection and prevention and control is important to everybody, but we can also look at looking at our patients and how risky are they to have some of these complications. So there's multiple factors, and a lot of them then are listed on that slide already for you. So susceptibility really changes with a person's age. One thing in nursing in general, not always, but just as a general rule, a lot of times when you look at any type of age, when you're looking at an age for something, when we look at the real young and when we look at the real old, they're always at an increased risk, it seems like. So when you're ever in doubt of it can go to a lot of different things on nursing questions. The old and young in general always have higher risk factors for different reasons. So when we talk about infection, infants are actually at a higher risk for infection because their defense mechanisms to fight off these infections are not mature. They have not fully developed the ability to defend off these microorganisms. Some of the things that can help with that, a lot of research has gone into the effects of breastfeeding. So breastfeeding helps increase the immunity because the baby does get the mother's antibodies. As they go into the child age, their immune systems starts to mature, but it's still more susceptible. And especially when we look at younger children who have not been immunized. So they have not been immunized against certain disease processes. They are at more risk for those things. Young and middle-aged adults, really, they're probably at their best ability to fight off those infections. They've kind of built up those defenses. And then again, we get to the older adults where that immune response, their body doesn't respond as well. It doesn't. It kind of declines, and really they end up more susceptible to those infections. Some of the other things listed on that slide is the nutritional status. So it's really important to get adequate protein and other nutrients from the body to help fight off infections. Protein, you'll hear a lot about that in regards to wound healing too. It really helps to fight off those infections and really helps if we have wounds or different body where those cells or things have died. It helps to kind of rebuild that area. So if somebody's not eating well, they may be weak. Again, they may not have the nutrients in the body for those adequate defense mechanisms. Stress also increases infection or our risk for infection. A lot of times if a person's been under stress for a long period of time, they have decreased resistance to those organisms and increased susceptibility to infections. Disease processes. If a person has a disease, especially of the immune system, like cancer, AIDS, different things like that, it really compromises the patient's ability to fight off an infection. Patients, for another example, a different example, a patient who got burned. If you think about your outer layer of skin being kind of that wall or that defense against blocking, it blocks all the other microorganisms and kind of keeps that out of the inside of your body. Well, if somebody gets burned, they burn that outside layer, they burn that skin, and it actually increases their risk for infection because that first layer of defense or that first line of defense is gone. It was burned away. A lot of patients might have chronic illnesses, and they're just really at risk because their body is so taxed and stressed by all these other illnesses. Again, it doesn't have the defense mechanism to ward off those microorganisms. If you're following along in your book right now, I'm skipping over what's called the nursing process. We'll learn about that in class coming up here shortly. But what I'm skipping to is if you're following along, we're picking up on page 455. Again, kind of looking at some terms. So if you turn to the next slide, it talks about asepsis. And there's some terms there that you can read on your own. But what we're really looking is at how to provide asepsis techniques and what's the difference between a couple of aseptic techniques that's important to provide our care and regarding what we're doing with our patient. So if you kind of look down, it classifies asepsis into two different types, medical and surgical. So medical there is also known as the clean technique, and surgical is the sterile technique. So if you want to think about medical asepsis, if something is done by medical asepsis or asepsis technique, really it's just our regular hand washing, using barrier techniques like wearing gloves, wearing a gown, wearing a mask, those types of things. really looking at routine cleaning. So we're going to routine kind of disinfection, those types of things. Surgical asepsis, on the other hand, requires more stringent techniques than just medical asepsis. So it's really directed at eliminating, not just reducing the microorganisms. One thing to think about is anytime the skin is broken or if there's an invasive procedure into the body cavity, we really want to follow surgical asepsis. So a lot of times we do like extra disinfecting of the skin, even if we're going to give a shot. There's going to be a lot of types of sterile procedures when we do anything like that. So really looking at, for instance, when we start an IV, it's an intravenous cath. It's going to be a catheter that goes into the vein. And we use a surgical asepsis. We're cleaning the area. We're using sterile devices that will go into the vein that way. So you can kind of read through those there, but just know the difference between the medical and surgical asepsis. So moving on to the next slide, really looking at what we call standard precautions. So standard precautions in general, like the slide says, prevent and control infection and its spread. So there's a couple of different ways, and we've talked about some of them already that we can do that. So standard precautions are what you'll hear for healthcare workers, and really it protects the patient and it protects us as the healthcare worker. So standard precautions are more, when we talk about standard precautions, they're more of a generic barrier technique that's really used when caring for all patients. That can include hand hygiene. Hand hygiene can come in the way of using the alcohol hand antiseptic before and after providing care. We might be washing our hands with soap and water when they're visibly soiled, or performing a surgical scrub. So what they say, if you don't know, if you aren't familiar with the word visibly soiled, a lot of times if you're just in between patient care, if there's nothing like that you can visibly see on your hands that they're dirty with, you are allowed to use the alcohol hand antiseptic. If you have seen something, if you can visibly see something on your hands, or a lot of times people will say, like after helping with urine or bodily fluids, they will also say to wash hands with soap and water. What I would actually point you out to is if you turn to page 458, on the second column, the WHO, the World Health Organization, recommends the following hand hygiene guidelines. So you can read number 1, 2, and 3, and they have some dots under there. That will give you some good indications of when to use alcohol hand gel and when to use soap and water to wash your hands. Hand washing is really the act of washing hands with soap and water, followed by a rinsing in a stream of 15 seconds. So you might have heard people say, you know, to make sure that they do that correctly, they'll sing things like Happy Birthday or Twinkle Twinkle Little Star in order to make sure that they know that they've done it adequately. As you turn to the next slide, it's labeled reducing or eliminating infectious agents. There's kind of 3 different main categories, and there's a lot of subcategories under them. But the main thing I want you to know is there's kind of different ways that if you want to term cleaning the products that we use to reduce or eliminate infectious agents. So we use 3 different processes to break that chain of infection. And so the first one is cleansing. So if we're cleansing something, we're really just removing the soil or the organic material from the instrument or the equipment that we used. So a lot of times we might do this to basically, it just helps loosen the material from the object. So it's kind of like you're, using water, detergent, those types of things that we might use to wipe down some equipment, different things like that. So sometimes if we use these, we can, wear, depending on what type of cleansing solutions that we're using, we might want to wear masks, gloves, or goggles because of the splashing and those types of things. Especially if if we can see stuff on there, to prevent us, again, from acquiring any of those types of diseases, moving from that equipment and making us portal of entry. That's when we really want to make sure we wear things like the mask and the glove and the goggles. Disinfection is the second category, and it gets a little bit more stringent. When we're disinfecting something, it eliminates the pathogens except the spores. So we might disinfect equipment, things like blood pressure cuffs, thermometers, stethoscopes, those types of things. At one time they did like bedpans and urinals. You don't really see that so much anymore. It's usually just kind of a one-time use, per person kind of thing. There's a lot of chemical disinfectants. You'll be familiar with what your facility uses, and so make sure that you do become familiar. So we might hear of things like bleach, alcohol, different things like that. Sterilization is the last category. So where's the difference between disinfection and sterilization? Remember, disinfection eliminated the pathogens, but not the spores, where sterilization eliminates everything, including the spores. So a lot of, especially the invasive instruments or procedures, things that we use for those types of procedures, need to be sterilized. There's a lot of different methods your book talks about. Moist heat or steam, chemicals, radiation, ethylene oxide gas, autoclaving. Those are all different types of sterilization. I'm not going to expect you to know the specific different types and all about them. One interesting note, I think autoclaving with moist heat and steam is probably one of the more common methods that we see. And a lot of times we might have seen our moms or different people, dads at home, use boiling water to sterilize something at home. But it's okay at home, but it's not just boiling water and sticking something into boiling water is not really considered a sterilization process at a healthcare facility. If you want to look more into that, there's actually there's some boxes there that talk a little bit more about sterilization and disinfectants that you can look at in your book. So looking at the next slide, infection prevention and control, really looking at patient safety. So some of the things that we're looking at and some of the things we might talk about or practice in lab would be wound cleaning, handling soiled and fluid waste products, separating personal care items, those types of things. Cough etiquette. A lot of times right now the CDC is recommending that people cough into their elbow. A lot of times they would recommend people covering their cough with their mouth, but then you're covering it with your hands. And a lot of times then people wouldn't wash their hands and just go touch a bunch of stuff, where your elbow's a lot less likely to touch other things. But there's a lot of control, infection control mechanisms that are already put into place, policies and procedures within the hospital or wherever type of healthcare environment that you work at. So a lot of facilities have their policies regarding a lot of those types of things. If you look at page 461, there's a procedural guideline on caring for the patient on isolation precautions. That's something that we'll be looking at a little bit more in class, but it would be a good thing to just kind of look through, but we'll be practicing that. As you turn to the next slide, looking at some other infection control measures, we'll talk in lab a little bit more about carrying soiled items away from the body. So when we're carrying something, carrying it away so that it's not touching ourselves as we're carrying that item. Keep skin dry and intact. Any type of moist or wet area, a lot of times it increases that risk for infection. Teach clients the proper peri-care. So how do we do proper peri-care in women? How do we do proper peri-care in men? So women, we want to wipe from front to back. Men, a lot of times we start at the shaft, at the tip, and then move inward towards the body. If a patient has catheters or urinary catheters, we might talk about that more in the catheter or the elimination lab. But we want to keep the drainage bag where that Foley or where that urine is emptying into that bag. We want to keep that bag below the level of the bladder. If it's higher, then a lot of times that urine then can back up in the tube and go back into the bladder and then up into the kidney. And it's already been exposed to a different type of environment outside the body, so it can actually increase their risk of bacteria and infection within the kidney or the bladder. Tubing ports we'll talk about throughout this semester and next semester and as through nursing school about cleaning ports, how to access those correctly, those types of things. And then there's a lot of different types of sterile dressing changes, different things like that, that you can always look at. There's all different things that we'll learn throughout the semester in order to do that correctly. Lastly, on this slide, it looks a little bit at patient education. If you turn to box 29-15 on page 467, it looks at our patient teaching. So one of our jobs, and we'll talk about this more in class, but one of our jobs as nurses is a lot of education to other nurses, to family members, and more specifically to patients. So read through box 29-15 on your own. It talks a lot about teaching strategies, how to work with your patient and family members, and educating them about infection prevention and control. All right, we're going to move on to the next slide, isolation and isolation precautions. So I've talked a little bit about standard precautions already. So healthcare facilities and all of us nurses use standard precautions in order just to prevent that routine transfer of microorganisms. Sometimes standard precautions, we really want to just assume that everybody could be infected or they could have some type of issue that we don't want to put ourselves at risk for. So we do standard precautions using the mask, gown, gloves, those types of things, or parts of that PPE or personal protective equipment. Really, they're precautions that we use, hand hygiene, safe injection practices, different things like that. We use standard precautions to just prevent anything. We'd rather be on the prevention side of things. There also are separate what are called isolation precautions, and there's a couple of them, or actually 4 of them listed on your slide there: airborne, droplet, contact, and protective. So isolation precautions are a specific set where we use the same PPE, and in some cases I'll talk about slightly different, but we use the PPE more specifically in a more specific set to protect against specific types of precautions. Those 4 types of isolation precautions that I have listed actually are discussed in your book on page 460. They go through contact precautions, droplet precautions, airborne, and protective environment. So we'll talk a little bit more about those in class more specifically. The thing, regardless of what type of isolation system, there's really kind of three main things, regardless whether it's standard precautions or isolation precautions. We really want to make sure that we're thoroughly doing our hand hygiene techniques before and after leaving the patient room. So before entering and before leaving the patient room. Making sure that there's different signs and supplies outside the patient's room. Do we have those supplies available? A lot of times with the isolation precautions, more specifically, they will have a basket or some type of a thing hanging on the door that will actually have the mask and the glove and the gown ready for you before entering that room. Everyone entering the room, even visitors, need to comply with those rules. And so a lot of times that's really hard because you have patients, family members that will say, well, they obviously had this at home and I was helping them at home, or I just got done sitting in the ER with them and before they checked out this lab, I was sitting there, without a gown or mask or something on. Well, it's not only really to protect them, but also it's protect the other patients in the hospital. So when you think about even the visitors going in and out of their room, they're walking through the halls of the hospitals, they're going out to other places, those types of things, touching other things. So even though they may have helped that patient before, a lot of it has to do even with the things going on inside the hospitals and the other patients that are in the hospitals that we need to protect. On the last couple of slides, I just want to touch on a couple of things. We'll be doing more with this in lab. Looking over surgical asepsis, we talked a little bit about that earlier. It's more of that sterile or surgical environment, that sterile field. So in lab, I'll be showing you how to maintain that sterile field and how we do things like that. We'll do a couple of things to practice that sterile field. If you turn to the last two slides, it has some principles of surgical asepsis that we'll be discussing in lab and kind of going over with. So again, as we complete this PowerPoint, making sure that your notes are ready to go for lab, whether you have your notes in the computer, making sure that you're able to show me each slide and that you have them completed, or whether you have them written out on paper, however it works for you, that's just fine. Just make sure that you have them available for me to see. You don't have to have them printed out. I will just look at it wherever it is, whether on paper or whether in your computer. You won't be handing it in or anything like that. So making sure as we complete this PowerPoint that you have that and you're ready to go and ready to be able to bring that to lab when it's on the calendar. Thank you so much, and we're excited to see you in lab for your first lab.